Hello friends, today our topic is necrotizing enterocolitis. So first of all, what is necrotizing enterocolitis? It is nothing but acute intestinal necrosis of unknown etiology. Okay, so what is necrotizing enterocolitis? It is acute intestinal necrosis of unknown etiology. Now, what are the causes? What are the causes of necrotizing enterocolitis? Causes. Number one, the most important cause of necrotizing enterocolitis is prematurity. Due to immature gut. As the gut is immature, so there is a high chance of necrotizing enterocolitis. Cause number two, asphyxia. Why asphyxia? As there is asphyxia, there is hypoxia, and this hypoxia leads to vasoconstriction, and due to this vasoconstriction there is impaired blood supply, which further proceeds to necrotizing enterocolitis. There is another factor which can give rise to this vasoconstriction. What is that? That is maternal cocaine abuse. So maternal cocaine abuse also leads to vasoconstriction. Cocaine abuse leads to vasoconstriction and finally leads to necrotizing enterocolitis. Now, cause number three. If the baby exposed to top feeds or formula feeds, then there is a chance of developing necrotizing enterocolitis. Why top feeds or formula feeds contribute to necrotizing enterocolitis? Because these top feeds or formula feeds encourages colonization of pathogenic bacteria, and this pathogenic bacterial colony may lead to necrotizing enterocolitis. The last but not the least, if there is a history of absent end-diastolic flow in umbilical artery in antenatal USG, this may also lead to necrotizing enterocolitis, absence of end-diastolic flow. Okay, now which part of the intestine most commonly involved in necrotizing enterocolitis? The answer is terminal ileum or ascending colon. So these parts are involved more compared to the terminal ileum and the ascending colon. Now let's understand the pathophysiology. Pathophysiology. Okay. Suppose this is the intestine of a premature newborn. These are the intestinal walls. And this yellow part is the lumen. This yellow part is the lumen of the intestine, filled with air and other things also. Now, when there is hypoxia, there is vasoconstriction. This intestinal wall is lined by epithelium. Okay, when there is vasoconstriction, which leads to decreased blood supply, this is very important, decreased blood supply, and due to this decreased blood supply there is necrosis of this epithelium or intestinal wall. Necrosis. When there is necrosis, the air from the lumen comes into the intestinal wall. Air in the intestinal wall. This is called pneumatosis intestinalis. Now, this air may further leak into peritoneum or into portal vein. When there is air in the peritoneum, we call it pneumoperitoneum, and when there is air in the portal vein, we call it pneumatosis portalis. So air into the peritoneum, pneumoperitoneum; air into the portal vein, pneumatosis portalis. When there is air in the peritoneum, there may be some bacteria can also approach from the lumen. Bacteria from the lumen may come into the peritoneum. Then we can call it bacterial peritonitis. Okay. Another thing to tell, when there is necrosis, from this necrosed cell there is blood in the feces. This may be a gross blood or occult blood. Okay, let's proceed further. Now let's classify necrotizing enterocolitis. Classification of necrotizing enterocolitis. There is a classification called Bell staging. Okay, now we'll learn this Bell staging. According to Bell staging, there are 3 stages: stage 1, stage 2, and stage 3. Okay, according to Bell's classification, stage 1, stage 2, and stage 3. What is stage 1? Stage 1 is suspect of necrotizing enterocolitis. Stage 2 is definite necrotizing enterocolitis, and stage 3 is advanced necrotizing enterocolitis. Now we can further subdivide these stages into 2. Stage 1A, 1B, 2A, 2B, 3A, and 3B. Okay. Now, what is stage 1A? When there is occult blood present in the stool. No gross blood. No gross blood, only occult blood is present in the stool. Then we call the stage as stage 1A. What is stage 1B? When there is gross blood present in the stool. Gross blood. Okay. If there is gross blood, then it is stage 1B. Now, stage 2A. If there is pneumatosis intestinalis, then it is stage 2A. And if there is pneumatosis portalis, then this is stage 2B. If there is peritonitis, then it is stage 3A. And if there is pneumoperitoneum, then it is stage 2B. So stage 1A, occult blood in stool. Stage 1B, gross blood in stool. Stage 2A, pneumatosis intestinalis, that means air in the intestinal wall. Stage 2B, pneumatosis portalis, that means air in portal vein. Stage 3A, peritonitis, and stage 3B, pneumoperitoneum, air in the peritoneal cavity. Now the management. How to manage? Up till stage 3A, up to this point, we can medically manage the patient. How? Medical management. We will keep the patient NPM and we will treat with broad spectrum antibiotics. So up to the stage 3A, we can medically treat by NPM and broad spectrum antibiotic and other supportive cares. But what if it is a stage 3B case? Then we have to surgically manage the case. Surgical management. If the patient is stable, then we can take the patient for surgery and we can perform laparotomy. But if the patient is unstable, then we have to carry out peritoneal drainage. Okay, so for stage 3B, we have to surgically manage the case. If the patient is stable, we can take the patient for laparotomy. If the patient is unstable, then we have to perform peritoneal drainage. Okay, Now, how to prevent necrotizing enterocolitis prevention. Number 1 is antenatal steroids. Antenatal steroids enhances the maturity of the gut, thus prevent from necrotizing enterocolitis. And number 2 is MEN. MEN. What is MEN? Minimal enteral nutrition. It is also called trophic feed, done for babies born before 28 weeks of gestation. Okay, now a quick recapitulation. What is necrotizing enterocolitis? It is acute intestinal necrosis of unknown etiology. What are the causes? Number 1, the most important cause is prematurity. 90% cases of necrotizing enterocolitis is found in prematures. Why? Because they are immature gut. Immaturity of the gut leads to necrotizing enterocolitis. Cause number 2, or risk factor number 2 is asphyxia. Asphyxia leads to hypoxia. This hypoxia causes vasoconstriction, which impairs the blood supply. And there is necrotizing enterocolitis. Maternal cocaine abuse also contribute to this vasoconstriction. Risk factor number 3, or cause 3, if the baby is exposed to top feed. Why? Because this top feeds or formula feeds enhances the colonization of pathogenic bacteria. Okay, and cause number 4 is absent end-diastolic flow in umbilical artery in antenatal UHG. Now, most commonly involved part of GIT in necrotizing enterocolitis, it is terminal ileum or ascending colon. Terminal ileum or the ascending colon. Now let's see the pathophysiology very briefly. As there is hypoxia, there is vasoconstriction, which leads to decreased blood supply. Then there is necrosis of the lining epithelium of gut. If there is necrosis, then air from the bowel can enter into the intestinal wall, which is called neomatosis intestinalis. Okay. Now this air may further proceeds into the peritoneum or into the portal vein. If it's entered the peritoneum, this is called pneumoperitoneum, and if it enters the portal vein, we call it neomatosis portalis. Now there is a classification of necrotizing enterocolitis, which is called Bell staging. Bell staging. There are 3 stages: stage 1, stage 2, and stage 3. Yes, all stages are further subdivided into A and B. Stage 1A is called suspect of NEC, means necrotizing enterocolitis. Stage 2 is definite necrotizing enterocolitis, and stage 3 is advanced necrotizing enterocolitis. Now, stage 1A, where occult blood is found in the stool. Stage 1B, gross blood. Stage 2A, neomatosis intestinalis. Stage 2B, neomatosis portalis. Stage 3A, peritonitis, and stage 3B, pneumoperitoneum. Now, how to manage up to stage 3A, up to stage 3A, that means 1A, 1B, 2A, 2B, and 3A, we can medically manage the cases by NPM, broad spectrum antibiotics, and supportive care. And for the stage 3B, that means pneumoperitoneum, air in the peritoneal cavity, we have to manage surgically. If the patient is stable, then we can take the patient for laparotomy. If the patient is unstable, then we have to perform peritoneal drainage. Okay. Now, last but not the least, how to prevent necrotizing enterocolitis. The number 1 modality is antenatal steroids. Antenatal steroids enhances the maturity of gut, that thus helps in prevention of necrotizing enterocolitis. And NEN, minimum enteral nutrition, which is also called trophic feed, that is practiced for the babies who are born less than 28 weeks of gestation, which also prevents against necrotizing enterocolitis. So this was all about necrotizing enterocolitis. Thank you.